Hi, Dr. Emily Kirby here, board certified plastic surgeon in Fort Worth. So we get a lot of people asking about the nipple with a breast lift and a breast reduction. And I think it's common urban legend that we remove the nipple. We don't normally do that. So there is a technique where we do that. We'll talk about that in a minute. So with a routine breast lift or a breast reduction, we actually keep the nipple attached, and we keep it attached to a very substantial portion of tissue. That tissue is called the pedicle. The pedicle is what supplies that nipple with the great blood supply that it needs to survive the surgery. So what we do is we keep the nipple attached and we rotate it into its new position, and then we close the tissue around in a very supportive fashion that holds that nipple and that breast where we want it to stay. So with that technique, it is likely that you will keep full sensation of the nipple. Now, I always tell people there is a chance that you could lose sensation with any breast surgery, but the standard techniques that we typically use, you should keep sensation. In a breast reduction, it's very similar to a breast lift, except we're removing a little more tissue or a lot more tissue. But similarly, the nipple being the most important part of the breast and the areola, which is the colored part around the nipple, we keep those intact, rotate them, support them with the remaining tissue. There is a technique where we plan to use the free nipple graft. So the free nipple graft is actually when we remove the nipple and the areola and we put it back on as a skin graft. The only planned reason to do that is if we have a really large breast, and that patient might want to go really small with her results. And if that's the case, the only way that I can guarantee a size like that is to remove the nipple and put it back on as a skin graft at the very end. That is called a free nipple graft. If that's the case, we have usually planned that ahead of time, and we have advised the patient that she will no longer have any sensation in that nipple and will not be able to breastfeed. So the free nipple graft is also a backup salvage technique if something were to go wrong during surgery. What I mean by that is when we do a breast reduction or a breast lift, we are looking at the nipple the entire time to make sure that it's pink, that it's warm, that it's got great blood supply, that it is acting like it has good blood supply. What we do in plastic surgery is make sure that everything that we leave at the end of the surgery has great blood supply. If it does not, that could be due to a variety of reasons. The room could be very cold. The local anesthetic that we injected could be making the blood supply spasm a little bit. The patient could be a smoker. There could be a lot of different reasons why that blood supply is not great to that nipple during the surgery. If we see that, we can do a lot of things to make that blood supply better during the surgery. If all of those things fail, then we might have to make the decision at the end of the case to remove that nipple and then put it right back on as a skin graft. Now, the chance of that happening when it has not been planned, far less than 1%. Very rare, but it's not zero, and that's important to remember. And now you know.